like to welcome you all today, wherever you may be, and acknowledge the Kulin Nations as the traditional owners of the lands on which we meet, wherever that may happen to be. So we have two presenters today and some really good, and I think I may have seen this presentation before, but really good topic and very thought-provoking for all health services. So first of all, Alice, who's with us today, I think it's Alice Vincent, brings a deep expertise in designing safe and inclusive public spaces, applying security designs principles to mitigate risk and enhance comfort for all users, especially women and other vulnerable groups. Her recent work at Westmead Health and Innovation Precinct combined lighting, security, and urban design strategies to create a welcoming 24/7 environment at the Randwick Health Precinct. She led technical assessments, co-design workshops, not workshops, to better understand how perceptions and safety shift at different times of the day. Also co-presenting is Rebecca, and I can't see your surname in my chat, but you can introduce yourselves once I'm done. Rebecca works as Centre on Building's more equitable urban environments through participatory design and collaborates closely with communities, including women, girls, and marginal groups, to ensure their voices shape safer, more responsive public spaces. Her experience spans health, education precincts, and she has contributed to leading policy and design initiatives such as the Women's Safety Strategy for the Rocks, Tambulada, as part of the New South Wales Safer Cities program, and the Queering Australian Cities publication advocating for inclusive urban environments. And I think we all understand that health has a huge population of vulnerable patients and staff members that work 24/7. So a number of these initiatives will resonate, I think, with all participants today and all health services. So I'll pass over to you to do any extra introductions you want to go through, and we can pick up questions either in the chat or at the end of the presentations and go from there. Thanks.
Perfect. Thank you very much, Michael. Thanks for having us, and thanks to everyone joining for this lunchtime session. As Michael noted, please put questions in the chat or put your hand up. We've got two laptops, so we'll be monitoring the questions, or if you want to save questions for the end, there's plenty of time at the end for questions as well. So our presentation is around nighttime design. It's basically how we create safe and equitable health precincts with a particular focus after dark. We'd also like to acknowledge the traditional owners of the lands, water, skies our firm may reach, and we acknowledge their wisdom, resilience, and rich cultural heritage. We pay our respects to the elders past and present and to all Aboriginal and Torres Strait Islander people. We recognise the ongoing journey of healing and reconciliation, and ARUP commits to walking alongside First Nations peoples to acknowledge their teachings and foster a future of unity and respect. So Michael already did a great introduction, but so my name's Alice Vincent. I'm an associate in the Resilience, Security and Risk team at ARUP. So for those who don't know, ARUP is a large engineering and design firm, global, and Rebecca and I both work in something called the Technical Specialists Group. So it's a kind of subgroup that does a lot of consultancy and advisory work, and often supports the larger engineering and design teams when we design things like large infrastructure projects or public realm work.
And my name is Rebecca Cadorin. I'm an associate as well, senior designer, sitting in the lighting team. So working across a whole lot of different projects, from kind of early strategy to master plan, all the way down into like detailed design and commissioning as well.
So our presentation will run for about 40 minutes. Plenty of time for Q&A afterwards, or pop questions in the chat as we go along. So we'll talk through what our nighttime design approach is, and then illustrate that nighttime design approach with 2 case studies that we think will be very relevant to this audience. So we worked on Randwick Health and Innovation Precinct, where we developed a nighttime master plan. And for Westmead Health Precinct, we did a lot of wayfinding and pathway upgrades, which really improved the nighttime experience for patients and staff. So when we talk about nighttime design, it kind of originated for us from a couple of challenges that we saw when we were doing design. So often the planning process doesn't consider variation of nighttime usage, if it even considers nighttime at all. So what we try to do is actually get people, whether that's the client, whether that's the other designers on the project, to really consider what the nighttime is, what people use it for, how the health precinct is used at nighttime. The other things that we see as challenges are that often different demographics are not considered. So if you think about a city, it's often designed for the 9 to 5 commuter. Often that commuter is able-bodied, often male. So what we try to do is make sure that everyone that uses or wants to use the space is considered when we design things. The third thing that comes up a lot as a challenge is that things such as the connections and adjacencies to a project site are not considered. So whilst a scope might stop at the project boundary, the human experience doesn't. So a person walks from a site to the bus stop, that is their journey. And we need to make sure as designers that we're considering the human journey, not just our little scope area. And then my background is in security consulting, and there's quite a limitation there in traditional approaches to security, where often we look at protecting the asset a lot more than protecting the people. And we also focus a lot on deterring the criminal rather than actually looking at the 99.9% of people that are trying to use the space positively. So those are the kind of things that we've seen in the last 6 or 7 years of working on this, and what we're trying to do about it with our nighttime design approach. All of our work is also grounded in global research that our company has undertaken, and that very much focuses on developing equitable, just and inclusive cities and spaces. These 4 types of research that we've done are actually very relevant in a health precinct setting as well. Designing for aging community is obviously very relevant when we think of the demographics of people often ending up in hospital or aged care for that matter. We have done research on rethinking the shades of night. We've looked at inclusive design. So how do you actually make spaces feel inclusive for the LGBTIQA+ community? And then finally, also looking at designing cities that work for women. So care work is actually highly feminized, as I'm sure you'll be aware of. So 70% of nighttime care workers are actually female. So in health precincts, a lot of the people walking around the space, especially after dark, will be women who have a very different perception of crime and fear of safety than men. And that's something we want to make sure is designed for.
So one of the areas that we've been continuing to research in is the nighttime. And this is the particular study that was kicked off in about 2015. So about 10 years ago, we've been collecting data on how people feel at nighttime within certain places around cities. So this one's looking at both Sydney and Melbourne. So working with Plan International and XYX Lab, we went to a lot of the locations where women and young girls had said that they felt unsafe because of the lighting, which was actually 1/3 of the respondents said that lighting was the impact for why they felt unsafe. So we went to each of these locations to really understand what it was about the location that made it feel unsafe for them. And from there, what we learned was actually things that we'd kind of been talking about for a while, but actually lighting contributes to a layer of experience. So it's not just the lighting that comes in at the end, but it's actually a holistic approach to it where we need to consider the users, how they're using the space, what are the materials within the space, understanding what the adjacencies and what the infrastructure and elements are as well, because lighting doesn't really understand boundaries and so can kind of impact positively and negatively. One of the other areas that Alice touched on before is like the traditional approach to designing the nighttime. And so with this research, we were able to look a little bit deeper into what it was the Australian standards were looking for versus what actually makes a space feel safe at nighttime. And a lot of the time, the Australian standards are really just pushing a lux level, which is a lux level on a horizontal and a vertical surface. But this isn't how we experience a space at nighttime. We actually see the trees around it, we see the awnings, we see the seating, and those kind of things can actually impact in how well the light spills within a space and how people move around it. So it's really kind of taking a different look at how we design for nighttime and make sure it's a little bit more holistic and work across teams as well. So from this research, we've developed up an approach which we talk about nighttime design, which is made up of 3 pillars. So equity, ecology, and economy. So under the equity kind of component is really around how do we design for diverse communities. When we're looking at ecology, it's looking at the natural rhythms within the space, making sure that we're considering the light pollution as well as biodiversity, because it's really important to balance the equity and ecology components together. And then, of course, the economy as well. So how can we deliver value through smart systems, but then also thinking about the impacts for users and workers within the space and retaining those staff. From the research, what we also learned were 5 key things. So the first one is brighter isn't safer. In a lot of the feedback that we got, we actually found that there was a threshold where there was too much light and people started to feel really unsafe. So if you think about a car park or a 7-Eleven, like they're really overlit, people don't tend to feel safe and want to move through really quickly because they think that something bad has happened, which is why a bunch of light has kind of come in. It also works against, the surrounding areas where if there isn't kind of light bleeding out around it, it makes those dark shadows feel even darker because of the high levels of contrast. The other component is a layered lighting approach. So often we end up with spaces that are homogeneously lit and very utilitarian feeling. So they might just have one light source. But when we look at layered lighting, we're kind of picking up the edges of the space, picking up the handrails, kind of showing people how they can move through it. So during the daytime, you see all of these details really well, but at night, that's kind of hidden and lost. The other one is warm white lighting. We really like the warm white light. It makes us feel a lot more invited. It makes it feel a lot more comfortable. And so thinking about this as opposed to a lot of the cooler white light sources that we see in our public domain really helps to kind of draw people in and make them feel comfortable. The last component, which we always bring into our projects where we can, is the co-design process. So actually getting out and asking people what it is about the spaces that make them feel safe or unsafe, and how would they like to use those spaces. We can, and we do often come up with like some key principles when we're working through projects, which can be applied across a few different typologies, but there's always nuances around particular spaces and particular groups that are using. And so it's always really important to carry out a co-design process when working on these. So I guess in summary, our approach looks out like a community engagement piece, the co-design element. We look at combining that with technical assessments because it's really important to have the qualitative and the quantitative component of the project so that we can actually help, I guess, also redefine some of the standards and policies later as well, so to be more inclusive. And then the last component is developing up a set of guidelines and principles that can be applied across projects.
All right, so we are now going to jump into looking at some case studies where we've applied the nighttime design approach. You can just see from this list here, we'll jump into Randwick and Westmead as they're both health precincts, but we've also applied this approach to CBDs, to universities, to town centre planning, to art galleries. We've done some work with private developers, as well as transport stations and bikeways or principal shared pathways. But we will speak mainly about Randwick and then Westmead. So Randwick Health and Innovation Precinct, we finished this nighttime master plan in September 2024. Our client was Randwick Health and Innovation Precinct, but the work was part of a broader Transport for New South Wales Safer Cities programme that we worked for. This just shows the kind of complexity of what we were working with. So whilst it was a hospital and a hospital precinct, we had the light rail stop going in, the Spot, which is a very popular retail kind of dining destination that's about a 5-minute walk from the hospital. There's a big school next door. There was Newmarket Retail and Residential, which was kind of a fancy new residential apartment block going up next door. You had the old Prince of Wales Hospital, a new ED department, a new children's hospital, and also very strong links into UNSW, which was another adjacency. So we can see here, we had a lot of stakeholders, but also we had a lot of permeability from different user groups moving through the site, which was what we wanted as well. We wanted this not to feel just like a hospital precinct that only people went if they needed to go to hospital, but was actually merged in with the social fabric of that whole Randwick area. So the purpose, the why of this project was that essentially the way people perceive and use health precincts is changing. No longer a place to visit when unwell, they are innovation districts, places of collaborative excellence, bringing academia, clinicians, education, and industry together to solve global challenges and nurture lifelong health. So that was nearly our kind of problem statement that we were trying to bring to life by applying a nighttime master plan to this quite complex health precinct. And the other challenges we had when we were working there were this was already a complex environment that operated 24/7. It had a very wide range of users. It functioned as public realm, and it was predominantly female. The majority of the nurses were female. The majority of the shift workers there were female. So we were really trying to cater for that specific demographic. And the vision given to us by Randwick Health and Innovation Precinct was that by understanding the shared values of our community, we will improve connectivity, economy, safety, and identity through creative and considered illumination. So the illumination there touches on the fact that we were looking in quite a lot of detail at lighting. One of the challenges we identified when we did a lot of our site visits was how incredibly dark the precinct was. But we weren't just trying to light it up in whatever way the Australian standards told us to. We were trying to do it in a creative, interesting, appealing way so that the nurses leaving a long shift or the patients that needed a bit of respite from their hospital room actually came out into an inviting public realm rather than just a floodlit plaza. So one of the things we did to make sure that we really understood the nighttime in this environment was we did a 24-hour usage mapping where we really looked at the different types of people using the space, the students, the visitors, the residents and patients, and then the shift workers, and the times of day they were actually using the precinct. And as you can see from the map that we created, there was a lot going on, either 24/7 or definitely after dark. Some of the busiest times being from about 5 or 6 p.m. when it got dark to 9 or 10 p.m. And even if the middle of the night was quieter, there were still things at that time as well. But this also just shows the deep variation in nighttime usage. It wasn't just one daytime typology and one nighttime typology. There was a variety as we went through the night.
Yeah. And so that was really interesting to do and important because it did show those variations of uses, and it showed that actually the lighting needed to respond to it. So typically when it comes to, after dark, it is essentially one type of lighting that is used from sunset until sunrise. But by doing this exercise, we really started to get into that granular look at who needed what when, particularly when we've got, some of the maintenance services coming through. How do we light for those, which might be different to how we might light for some of the shift workers? From carrying out the early co-design workshops and the technical assessments, we came up with 6 key challenges that were identified across the precinct that were impacting people's perceptions of safety at nighttime. And this is also because I guess it's more of a historic kind of site as well, and they've had buildings kind of coming on over time. But the first one was wayfinding. People found it really difficult to know where they were going and where they needed to get to and how to get there. There was a lot of signage that was redundant and kind of hadn't been taken off as new things had came on board. So that was one really big component of it. Another one was the ambiguous and uninvited spaces. So a lot of people were unsure whether open spaces were meant for them, whether they were designed for them to be able to use, or whether they were private or public use. So this was a really big part as well, because a lot of the staff were unsure whether they could take their breaks in certain areas. The next one was a lack of community access and poor pedestrian experience. So again, like a lot of the vehicles were given priority throughout a lot of the roads. And so for people trying to cut through or kind of get from one side to the other, it was a really bad experience for them in terms of the cars move really quickly. There wasn't any signage, and just overall felt unsafe for them to actually be able to move within the precinct on the footpaths and the roads.
Let alone if you had a pram or were in a wheelchair or an injured leg. Like, it was bad enough for any pedestrian. But yeah, it was a real car dominated precinct.
The other one was vulnerability. So people not being able to see and be seen throughout the precinct. So there was lots of nooks and crannies where people could actually hide. And so when walking through after dark, people were really unsure if there was anybody else. Well, a lot of the time there wasn't anybody else around because it wasn't a very inviting environment. So that sense of having others around was really strong. This next one, open spaces, also linked with the ambiguous spaces, but there was a lack of spaces for people to be able to relax within the precinct. Post kind of looking at some of these ideas, some of those outside spaces are being used a lot more in the evening. And then the last one, which comes down to the lighting, was really just inconsistent lighting across the entire precinct. So there wasn't any hierarchy in terms of which roads should be used over others for pedestrians versus vehicles. And there was really lots of patches the whole way throughout. So lots of really dark spaces where people were wanting to move between. So a part of what we did once we had the co-design workshops was then actually start to look at what were some of the interventions that could be implemented over a short, medium and long term. And this is because also kind of working with the team, we realized that you're not able to do everything from day one. It's impossible, but then also how could you potentially stage these out in terms of impact as well? So like, what are some of the smaller kind of things that could be done in 1 to 2 years, which would help with some of the wayfinding and help with kind of inviting people in. But then what were some of the more longer term things? So looking at a 2 to 5 years and then 10 years plus. So some of those things in the 1 to 2 years, which we're looking at, how do we light some of the vegetation throughout the area? How do we improve access to the green spaces that were existing? How can we support the wayfinding and then incorporate some more artist residents within the precinct? So these projects, we've actually had about 4 or 5 that were from this, which have already started to roll out. So there's a piece with Rochelle Haley, which looked at wayfinding and incorporating artists, which is the Lunar Sway. She's also gone on to do some other pieces around the murals, which has helped to activate some of the roads throughout the precincts, so particularly Francis Martin Drive, which links Avoca Street across to the Prince Wales Acute Services building. So that's really become much more of a thoroughfare for people. And then the longer term ones, so 2 to 5 years, we're sort of working through still with those ones with Sophie and the team at Randwick. One of the other components that we did a part of the master plan was actually put together a list of typologies and kind of help them with some guidelines that could be given to future developments, because hospital precincts are always growing, they're always changing. And so one of the big components that we noticed was, one, the inconsistent lighting and approach. So by putting together a kit of parts, essentially, the team are able to roll this out as new developments kind of come on, or as maintenance needs to happen. They have like a kit that they can refer to, which gives them guidelines on typologies and color temperatures and lighting levels. So jumping into Westmead, which is the other one that we were having a look at. So the project aim for this one, so was looking at addressing the safety concerns of the doctors and nurses, and again, looking at developing guidelines for future precincts redevelopment. Some of the challenges that we came across, particularly for this one, was a lot of the walkability, especially from the car parks and to the transport hubs and to the place of work. So a lot of where people had to park was actually a couple of Ks away. And then at lunchtime, they would take their lunchtime, go down, get the car and kind of bring the car closer to them, so that when they knock off at nighttime, they were able to get to the car a little bit easier. There's lots of ambiguous spaces as well. So a lot of what some of the ideas that we came up with for this one was particularly looking at lighting, but also some more urban interventions. So some of the things where we looked at was increased the pedestrian crossings, so making sure that they were marked and they were highly visible, because a lot of the area wasn't actually walkable. The other one was looking at footpaths. So some areas there were footpaths, some there weren't footpaths. Where there were, they were really too narrow for 2 people or for 1 person to walk with a pram. So we looked at some guidelines around how you increase some of those footpaths, and where some of those key footpaths that connect some of the transport hubs and car parks for the staff were incorporated.
So it's kind of a combination of illuminating the pathways like you see in the middle image, but also giving the legibility, saying, for example, stair access to Hawkesbury Road, so that people knew that that was a path they could take to get to the transport route that they wanted to go to.
Yeah. And while this one shows the purple lighting, it's not purple lighting all the time. That was kind of like the night when we kicked everything off. I think something that's been really exciting for us to be able to see these projects like from the beginning all the way through to the end is actually to get some of the post-occupancy survey results. So post having some of these ideas and interventions incorporated into the public domain. So looking at this one is from Westmead. And so this is looking at how safe people felt walking between the green spaces from the transport hub to the place of work to the car park. 9% of the respondents felt safe at nighttime previously. After the lighting interventions went in, after some of the footpath widening and dedicated pedestrian crossings, that went up to 75%. So we think that that's a really exciting statistic and something that we can actually start to share around a lot more. We did have similar results with Randwick as well, whereas before people kind of felt safe, around 48% of people felt safe working around, I think because it is quite a busy, and that increased up to 82% after the interventions. So some really exciting things coming through from there. So I think in summary, some of the key takeaways that I would like people to think about is that nighttime design is multidisciplinary. You can't think of it just as a purely lighting approach, or you can't think of it just purely of I've done my SEPTED tick, that's going to meet everything. It really needs to bring the disciplines together. Compliance isn't enough. The Australian standards don't go far enough to take into consideration how people actually use and perceive a space. So it really needs to be that compliance plus approach to doing it. collecting data and evidence is key for these kind of things, because we are still kind of governed by the standards that we have, that we need to collect this information to show the benefits for doing this kind of work, how it makes it easier for people to use spaces, how you get more use, how you get more dwell time from people using them. That we've also got better nighttime environments, equal multiplier benefits, and that we need to kind of think about these like short, medium, and long term as well. So investing strategically, so having a map of where you want to end, where you want to go, but the guide points on how you get there. So I think what we were going to end with before we kind of cross to some questions, the short video from the brand
program is investing $30 million over 2 years to help improve perceptions of safety in our cities and towns for women, girls, and gender diverse people.
At the Randwick Health and Innovation Precinct, we want our community to feel safe, no matter what time it is. Around 80% of our health workforce are women, and 24 hours a day, 365 days a year, we have staff here on site at night time.
With support from Safer Cities, we've engaged ARUP to develop a lighting strategy for our precincts. We're working closely together with ARUP and drawing on their expertise in co-design, lighting, and gender-sensitive design. This helps us shape our priorities for lighting artwork commissions, design briefs, laneway transformations, and to inform redevelopment.
We're here at Randwick Health Innovation Precinct, and we're carrying out a co-design workshop with community and workers around how to design our nighttime environment for safer and inclusive spaces. We asked people how they felt about whether they're included in a space, their perceptions of safety, and also got them to tell us about some ideas around public art installation that they'd like to see around the precinct.
I thought about how I felt at night, coming out and being involved in the process to highlight what I find scary, but then also being confident that there are solutions.
So we just think it was good that we got consulted on the writing and all the things they would like to change, just to get everyone's input on the people that work in the area.
We are grateful for Transport for New South Wales Safer Cities program. It's helping us to co-design and connect our workforce and communities, supporting us to improve our streetscape so everybody can feel safe day and night.
Great. Well, that was the end of our presentation. Very keen to hear if anyone has any questions.
So can you see the chat?
Yeah, we've just got this one open here. So we've got one question from Sasha. Thanks for the lovely presentation. You mentioned light pollution and referred to some research and guidelines documents. I'm interested to touch on the dark sky planning guideline and whether this framework also informs your lighting designs, and if that presents any challenges in some of the uplighting concepts that you want to implement within landscape and elements. Yeah, awesome. Yes, we do look at a lot of the dark sky planning guidelines, as well as there are some wildlife ecology guidelines that were released, I think, a couple of years ago. So we do consider that in the designs that we come up with. When we're looking at some of the uplights, we do think about the spectrum of light that we use for those, and then also think about using sensors and timers as well. So really kind of using the uplighting while we've got lots of people around within the precinct. So those discretionary hours, so sunset to around 10, 11 o'clock, and then we tend to dim the uplights and things like that down after that time, so that we can actually let the trees and then flora and fauna rest as well. One of the other aspects that we tend to look at is, I mentioned the spectrum of lighting. So light's made up of lots of different wavelengths, and while you can't have one particular wavelength that works for everybody and everything, amber tends to be one that is least harmful or least impactful. So where we've got lots of urban areas, lots of trees and things like that, we'll often switch the lights over to an amber, which can then be left at night time. So then it feels safe still for people to walk through, but it's having a minimal impact. I hope that helps answer your question. Okay. Next one, process of master designing, understanding why and co-designing is wonderful. Thanks for sharing. One question out of curiosity, for the Westmead case study, what are the most critical design elements that made the significant improvement from 9% feeling safe to 75% people feeling safe? And that's from Aaron at Queensland Health.
I think in Westmead, the main problem was that people felt so unsafe leaving the hospital building and walking to not so much the car park, because the car park wasn't that far away, but it was really to the transport hubs. There's a light rail stop and there's a train station. They'd often feel so uncomfortable that they'd have to walk in groups, or just order Ubers straight from the hospital entrance, which obviously has a socio-economic impact when you could get public transport and you're paying for private transport, or having to wait until 2 other people finish their shift to walk to the transport hub. So by lighting up the pathways and by making them more legible meant that more people were using them, which meant you were more activated. It's more activated, so when you're walking along there are more likely to be other people walking as well, which makes you feel safer. So I think it was basically improving the walkability of the precinct after dark, which created that sense of safety.
Yeah, and in particular, there was one kind of park that linked the light rail that Alice was mentioning and the hospital precinct, which was completely dark at nighttime. So if people couldn't cut through it, it was a little bit too scary. So that's where we had the handrail lighting going in and updating like the pole lighting through there.
Thank you.
Any other questions anyone want to jump on?
So from a big tertiary hospital in a major city, the Royal Melbourne Hospital, we have a number of transport hubs around the hospital, and I'm sure that most hospitals with the workforce that we have that are on traditional 7 till 3, 3 to 11, 11 to 7 shift patterns, and I saw your nice little circle showing the shift patterns and where they fit. I think there's a lot of learning in what you've done in this space collaboratively with the staff and the community that are sharing that space. There must have been a lot of really good learnings about what are people's concerns, and good to hear just then that you're taking into account the habitat, if you do have big parks and things around, how you don't saturate the place with light and affect native animals that may well be close. Not that we have any near the Royal Melbourne, we are in urban downtown metro Melbourne, but I think there's a lot of key learnings there. So have you, clearly you've published this, but have you done any other work in other places that have drawn down similar concerns from people feeling safe, and any other experiences, or it's sort of all wrapped up in this one presentation?
I mean, so we in this presentation really drilled down into health precincts. The other kind of health precinct / CBD blend we did was actually Liverpool. So we worked with the Liverpool Innovation Precinct, which connected the CBD with the hospital. And there, a lot of people that worked at the hospital weren't using the public transport hub, even though it was a 10-minute walk away, but they just didn't feel safe walking through Liverpool at night. And that then created kind of secondary knock-on effects of they had really congested car parks, nowhere to park, etc. So, and actually they told us that they had real issues with staff retention because the female staff felt so unsafe, not working at the hospital, but just being in the vicinity of the hospital. And we spoke a little bit earlier about the economy. So what we heard in Liverpool as well was there was nowhere near the hospital to go and have a coffee or a nice like after work drink or go and get a sandwich that wasn't in the canteen of the hospital. So a lot of the time healthcare workers, they're not really catered for in the same way that CBD consultants are, even though they have money to spend on their lunch break and would like to. if there was something more diverse around there. So whilst we mainly look at safety, it's actually also providing decent amenities for the people that work and also visitors at hospitals.
And I think also to kind of one other element that we didn't touch on too much, but that kind of the art approach as well within these precincts. So particularly at Randwick, we had a big focus around how we incorporate art to actually help with wayfinding. So the image that we've got up at the moment, which is the Lunar Sway, that's right at the Avoca Street entry, and that kind of helped to draw people into the precinct. And while we were commissioning this one, actually, we had a number of staff kind of stopped, like walk past, and then they stopped and came back and they were like, what are you doing? I'm really interested. And one male nurse was like, oh, this is really beautiful. It kind of makes a magical moment at the end of my day, you know, as I'm leaving the precinct. And then we had people from across the road, residents kind of coming over as well, and just saying how it completely changes the atmosphere for them and kind of makes it feel more inviting. So I think art actually has like a really big component to play with how we design our environments, and actually make it a little bit more accessible for people to kind of come in for, because I think people use places that they love, and that have a really nice story that's connected to the place, and that's what we've started to do, I think, with Randwick and also Westmead.
That's great, thank you. Not seeing anything else in the chat. I'm pretty sure Vanessa's got your details that we can put up on the website, and if people wish to engage you further, actually, another question did jump up.
As an interior design student interested in lighting design, I'm particularly curious how you approach glare control and visual comfort for patients who are often lying down with sensory impairments. Okay, you're talking about inside the actual hospital bedrooms. There's a couple of different things. I think like the thing that's probably, or the lighting approach that's probably most comfortable for patients is a lot of indirect lighting. So that's lighting where you might light up the ceiling so that the light source is not actually pointing down or into their eyes, or something that's really soft and diffused as well. So if you think about like your glowy lamps and things, will be really comfortable. There's lots of different light fixtures which have different beam controls and angles and things like that you can look at, but I would recommend always starting with an indirect light approach to make it comfortable for patients. That's a really big area on itself as well, kind of thinking about that and kind of thinking about how you connect patients with the outside world, circadian rhythms and all of that. So it's a big topic which we could talk for hours on as well. So feel free to reach out, V.
Yeah, thanks for that. Just slightly side issue, but still in the comfort and lighting space. As I was saying, Vanessa has your details. We'll put them onto the IHEA website. Anyone who wants to reach out further or engage with ARUPs and your services, clearly that's an option. And as I said in the beginning, I think you've mapped quite well what a health service looks like over that 24-hour journey. And I don't think there's a hospital or a health service within, well, probably worldwide, that wouldn't be grappling with the same type of issues, slightly different environments, but there clearly is a sense of anxiousness around a hospital at night, partly because we attract not so desirable people to, say, our emergency departments, who then end up back out in that environment that people are moving through at certain times of the day. So I think there's some really good learnings in your presentation, and I think, I think it would be well received. Did the unions get involved in any way, ANMF or any of those core staffing consulting groups, or did they? Oh, have you presented to the ANMF these findings? Because I think they'd be really interested. As you said, 80% of staff are female in a hospital. So I think they might be very interested in this as an overarching project in health across Australia.
Yeah, we actually haven't. So that's a great suggestion. We should get onto that.
I certainly think
Definitely.
they'd be very interested in your findings because they deal with a lot of the negative outcomes of staff and working around the clock 24/7 and how that impacts on staff and staff safety as a whole. So thank you very much. It's a great presentation. I think you got some great learnings, really good data, good photos, and lots of information to share that it resonates across the field. I think we could all use a review from your team to just to give us a baseline of opportunities. And clearly you've learned a lot in these projects around some of the sensitivities. So I think it's great. So really appreciate your presentation today, and we will be placing this entire presentation onto the IHEA website and contact details for both the two of you, Alice and Rebecca. Thanks.
Great. Thank you for having us. And yeah, see you soon.
Thank you, Michael. Thank you, everybody.